जय हिंद एंड गुड आफ्टरनून। तो आज का टॉपिक ऑफ डिस्कशन है ऑर्गेनिक ब्रेन डिसऑर्डर। So do you understand what is meant by organic term? Right. How is it different than psychiatric illness? Anyone? So let us move and we'll find it out, okay? So we'll be covering the topic under the following headings: introduction, prevalence, incidence, classification, etiology, psychopathology, clinical feature, diagnosis, differential diagnosis. And last 3 points, please take notes of them कि ये आपके लिए important होने वाला है. Nursing assessment, treatment modalities and nursing management, follow-up care and home care rehabilitation. So, organic brain disorder, what does it refer to? It refers to a range of psychological and neurological conditions with a physical cause in brain structure. So, there is going to be an identifiable injury, or there can be any trauma, direct trauma, any chemical injury, any neurotoxin, any degenerative brain disease which can lead to the symptoms that we can see in organic brain disorder. All right. So next we'll move on to the prevalence and incidence. What do you understand by prevalence and incidence? Anyone? एक साथ बोल दो बताओ. Okay, very good. So worldwide, the pattern which we are seeing that in past 20 to 30 years, the number of cases of organic brain disorder is on rise. So it is one of the major cause for morbidity and mortality worldwide. Okay. So according to the data from the Global Burden of Disease Study 2019, neurological disorders are leading cause of disability and death worldwide. Again, the global disease of the burden of neurological disorders have increased to a very large fold when we compare the data from 1990 to 2019. The global prevalence of dementia has also increased, maybe because the lifespan of the individuals have increased. In India as well, the pattern is same that we see in the across the world. Both dementia, delirium, these kind of illnesses are on rise. Again, the incidences of traumatic brain injury, which estimates between 27 to 69 million cases across the world, is on increase. Now moving on to the classification. See, when we talk about classification of organic brain disorder, we can classify it according to the cause, according to the structure of the brain which is affected. But ICD-10, it classifies the organic brain disorder into the following category: delirium, dementia, organic amnesic syndrome, organic mental disorder due to brain damage and dysfunction, personality and behavior disorder due to brain disease, damage and dysfunction, unspecified organic or symptomatic mental disorder. All right. Next, moving on, this is just an overview of what we have already seen. Etiology, based on the causes, what can be the causes of organic brain disorder? There are several number of causes. Moving on to vascular causes like TIA, that is transient ischemic attack, or chronic hypertension or strokes, they can cause vascular dementia or other cognitive impairment. Infections like encephalitis, meningitis, prion disease, acute brain damage, so they can also result in organic conditions. Next, moving on to traumatic brain injury. Direct trauma, okay, or from the accident or any other cause can cause post-confusion syndrome, cognitive deficit. And there's a very interesting case. There was one person who was very calm and quiet. After an injury to his brain, traumatic brain injury, he had an injury from a long metal rod. So post-injury, his behavior and his personality all of a sudden changed. He became very aggressive, very volatile. So when you see a person of head injury, even the person has recovered, ICU से छुट्टी हो गई है, फिर भी कुछ कुछ symptoms mood wise, behavior wise आपको दिखाई देंगे. So you can keep this in mind. और अगर कल के दिन आप ऐसा कोई patient देखते हैं तो आपको याद रहना चाहिए कि हाँ इसको कभी चोट लगी हो सकती है. Again, neurodegenerative disease like Alzheimer's, Parkinson's, Huntington's, you see many of the sign and symptom related to organic brain disorders. Then substance abuse, chronic alcohol, other kind of drug addiction, metabolic and endocrine disorders can also cause some kind of pathology in your brain. Autoimmune disorders and many a time some of the prescribed medications, opioid, hypnotics and steroids. Again, tumor and space occupying lesion and nutritional deficiencies like B12 deficiency. Again, this is also the same short form of what we have already seen. Now, what happens in the brain structurally and micro level mein when we talk about the organic brain disorder? Neurodegeneration is the term. Now, name se hi clear hai, degeneration of neurons. So, neuron function and structures are progressively at loss, जैसे कि dementia में आपको देखने को मिलता है. All right. Next is inflammation. Whenever an inflammatory response is occurring anywhere in the body, you have a very strong immune response. तो आपकी inflammatory bodies react out करेगी और आपका damage करेगी particular structure of brain को. Then impaired blood flow to the brain can cause ischemic injury. We have already seen that. Neurotransmitter imbalance. There are many neurochemicals like dopamine, etc. in our brain which get disbalanced when talking about the organic brain disorder. Again, the area of brain affected, like in Alzheimer's disease, hippocampus is affected. We have another disease which we call frontotemporal dementia, in which the frontal area of the brain is affected. So depending upon which area of the brain is affected, sign and symptom will also vary. All right. Then again, genetic and underlying hereditary causes can be the reason. So if you see the advanced encephalopathic brain, you can make out the difference between a normal brain. It is more even, and when you can see an uneven encephalopathic brain. This is how grossly the brain appears. Similarly, in case of dementia, more brittle, more spaces, and all the what we call the fissures along the brain all have been in a rise. Now the clinical features. What all can you see in the clinical features of organic brain disorder? Can anyone tell me? Very good. Sorry? Loss of consciousness. Very good. Very brave. Okay. So whatever you all told me, we can divide it into cognitive changes, behavioral changes, emotional and neurological changes. So what happens in cognitive sign and symptoms? Memory impairment. So whenever you'll see a patient of dementia, you'll see ki short-term memory loss, then progressive long-term memory loss will be there. Impaired attention and concentration, difficulty focusing on task or following conversation. Executive functions like planning or making some important decision, it will be difficult for them to carry out these things. Language impairment, like aphasia is a term when you'll have difficulty finding right words, in difficulty comprehending what you have to speak. And again, visuospatial dysfunction. Spatial awareness means where you're sitting, there are familiar objects around them, so there's going to be dysfunction in that as well. Again, in behavioral changes, like you all said, agitation, restlessness. Apathy means no interest in enjoyable activities. Social withdrawal is going to be there. Disinhibitory or inappropriate behavior. Many a time you'll see many elderly patients जिनको dementia होता है, they'll disrobe their clothes. They don't know how to, behave in front of people. They might abuse people without any cause. Aggression and hostility. Then emotional and mood, again, depression, anxiety, and emotional lability is something which you should keep in mind. Psychotic symptom, this is very important because this is something which will come in differential diagnosis as well. Delusions and hallucinations. What is a delusion? False, unshakable belief. And hallucination? Without any perception, you will see if there is someone or not, all right? So in neurological symptom, very important motor dysfunction like abnormal muscle weakness, tremors, difficulty maintaining balance, difficulty walking, gait disturbances. This is all you will see in motor dysfunction. Sensory disturbances, impaired vision, hearing, sensation, numbness, and seizure activity. Loss of consciousness associated with confusion. Difficulty maintaining or falling asleep. Sleep cycle may get disturbed कि सुबह के time पे सो रहा है, रात भर उठा रहता है पर patient. This is all the complaint you can get. Again, autonomic dysfunction like abnormal sweating, increased heart rate, etc. So how are you going to make a diagnosis and what are the differential diagnosis? Just we'll go through it in a short way because we'll also see in nursing assessment as well. So medical history, physical examination, mental status examination, neuroimaging is something you should keep in mind. Okay, this is how the dementia brain appears in CT scan. And laboratory investigation like blood investigation to see if there is any deficiency of any vitamins or any hemoglobin deficiency or any underlying infection is there or not. Neuropsych testing and EEG to record the seizure activity for the same. Again, in differential diagnosis, though there are many conditions, but most important thing is you should remember how to differentiate it from psychiatric illness. Okay. In psychiatric illness also you will see hallucination and delusion in disorganized behavior. In organic brain disorder you will also see. So one thing you have to see कि out of a sudden अचानक से okay अगर कोई symptom आ रहे तो please suspect organicity. A young patient is presenting to you, he was all right till yesterday and अचानक से today he had an episode of loss of consciousness and after which he's getting aggressive, volatile. So suspect organicity. Go for necessary investigatory procedure with that patient. All right. Like similar in depression, cognitive impairment can occur which can mimic dementia. अदर न्यूरोलॉजिकल फंक्शन में रिमेंबर फंक्शनल न्यूरोलॉजिकल डिसऑर्डर आप बहुत बार देखते होंगे पेशेंट इमरजेंसी में आया फंक्शनल पेशेंट है कोई कॉज ही नहीं निकल रहा है सो दिस इज समथिंग persisting they'll present with motor and sensory deficit but it will lack structural brain changes okay no other psychopathology you will find but there might be history of abnormal movement there might be history of unconsciousness but no underlying cause will be determined clear. Then you have multiple sclerosis, systemic condition, inflammatory diseases, infective pathology, and substance abuse. Now, very important from your point of view, okay? So, again, history taking mein, what do you all do? What do you ask in history? All of you are familiar with history taking? Lete ho history? So, what do you do? Stand up until now. Very good, you will keep this in mind. Now, tell. Very good. चीफ कंप्लेंट्स किस वजह से आया है वेरी गुड एवरीथिंग इज रिटन ना ठीक है गैदर डिटेल इंफॉर्मेशन अबाउट पास्ट इलनेस इंजरीज इन्फेक्शन मेडिकेशन यूज ओके एंड associated comorbid कोई psychiatric illness तो नहीं है that also you have to take okay and family history any history of neurodegenerative diseases or any organic disease in family or not. Then in physical examination, other than vitals and everything, please put a good emphasis on neurological examination in this, especially sensory and motor examination. Look for signs of trauma, infection, look for any chronic conditions. Again, mental status examination and behavioral assessment. What do you see in mental status examination? Hmm. So you will, yes, yes, very good. So check for depression, anxiety, mood swing, cognitive and behavioral symptom. ठीक है memory सी दी आपका जो attention deficit वाला portion है जिसमें थोड़ा सा आपको ध्यान है memory, cognition, ठीक है orientation, confusion ऐसी state तो नहीं है this all you have to keep in mind. Next is nutritional and hydration status again for nutritional deficiency whether the input output is maintained or not. Next is functional assessment very important we have to determine whether the patient is able to carry on his daily pursuits or not. Self-care like taking bath, dressing, eating, managing medication. Okay, if there is any cognitive decline, how fast is the decline? Then psychosocial assessment, evaluate patient's social support system. What is the attitude of family members towards the disease and towards the patient? Are they understanding what the patient is going through and how is this different from other physical illnesses? Environmental assessment, this we'll see later on, and monitoring of complications. Now, treatment modalities, important part of treatment modalities is that we'll see how we can manage the symptom, how can we decrease the progression of disease, and how can we enhance the quality of life of the patient. So, you have the role in maintaining the quality of life of the patient as well. Okay, we can have pharmacological treatment, we can have non-pharmacological treatment. So, symptomatic management अगर dehydration है, fever है, pain है, तो medications according to what the symptoms are. Other than that, we have some neuroprotective drugs like acetylcholinesterase inhibitors, donepezil, rivastigmine for dementia and everything. Then अगर कोई infection है तो you'll go antibiotics. Then antipsychotic for maintaining the any psychopathic symptoms है कि नहीं. Depressants and mood stabilizer and anticonvulsant. वेरी इंपॉर्टेंट, अगर ट्रॉमा का पेशेंट है, हेमरेज का पेशेंट है, न्यूरोसर्जिकल इंटरवेंशन भी चाहिए. बहुत बार इमीडिएट न्यूरोसर्जरी रेफरेंस कराना पड़ता है, पेशेंट को इमीडिएट को ऑपरेट करना पड़ता है, so to prevent the further damage. Non-pharmacological, this also we'll see later on, cognitive rehabilitation, occupational rehabilitation and psychotherapies, they all have role. Diet में vitamin B12 is very important that you should keep in mind, and regular physical activity and maintaining sleep cycle and hygiene of the patient is important. Again, environmental modification to see whether the patient is in secure and safe environment or not. Okay, because many a time dementia patient or patient who are confused, they have a tendency to fall or wander away. So you have to see कि railing लगी है कि नहीं लगी है bed post में. You have to see कि lock लगा के घर में है तो ढंग से लगा है कि नहीं है. ठीक है, whether the patient is oriented कि अभी दिन है कि अभी निकलना नहीं है, रात है कि बैठना है. All right. Again, then family counseling, explaining the family members about the disorders and giving your support. And palliative care, managing symptoms in end of life stage कि आपको कैसे उनको calm down रखना है, how to improve the quality of life. Again, so symptom management will be the key point in nursing management, patient safety, enhancing quality and supporting family members. Again, assessment and monitoring, you have seen, you'll see if there is associated cognitive decline when even the patient is in ward. Once the patient is admitted, patient is in ward, nursing staff is the one who spends maximum time with the patient. Doctor आएगा, round लेगा, orders डालेगा. Maybe junior doctors will be there, but you are the people who are going to spend maximum number of time. So you have ample amount of time to observe the behavior of the patient, if there is any progress or if there is any decline in the condition of the patient. You have the right to immediately inform the doctor कि ये patient worsen हो रहा है कि ये improve हो रहा है. You can see how he is behaving with other fellows as well. Continuous evaluation of cognitive function, mental status and physical health. Monitoring for potential complications such as infection or worsening neurological symptoms. Then medication management. प्रिस्क्राइब मेडिकेशन सही डोज पे सही टाइम पे जा रही है कि नहीं जा रही है, किसी ड्रग का कोई एडवर्स रिएक्शन या कोई साइड इफेक्ट तो नहीं हुआ है, कोई दवाई स्किप तो नहीं हुई है. बहुत बार ओरली पेशेंट दवाई सॉलो ही नहीं करता है, इधर उधर फेंक देता है, अगर ये कोई प्रॉब्लम तो नहीं आ रही है. सो दिस इज ऑल विच यू कैन कीप इन माइंड एंड कैन इन्फॉर्म इमीडिएटली. Behavioral and cognitive management. Many time ऐसा होगा कि patient might get aggressive, may become volatile, so you can take some behavioral intervention within the ward itself. Many a time you need to restrain a patient because he is getting aggressive. So when is it required? What will you do if you find such a patient? You'll immediately inform the duty doctor. You'll follow the orders if they have said कि आपको उसको restrain करना है कि नहीं करना है. Implementing reality orientation and remotivation techniques to reduce confusion and improve engagement. Providing cognitive stimulation. अगर एक जो आपका वार्ड का बिहेवियर है उसको सही से रखना है कि जो वार्ड मेंटेन है उसमें खिड़की हो, पता चले रात हो रही है कि दिन हो रहा है. You can have a calendar and a clock in the ward so that the patient is regularly oriented कि time क्या है. You can greet patient, you can talk to the patient every day. So these are the things which you should keep in mind. All right. And then you have psychosocial support, offering emotional support to the patient and caregiver, addressing feelings of fear, depression, and frustration, encouraging involvement of family in care process. Patient safety, again, fall prevention, including removing environmental hazards like sharp objects, etc. Ensuring safe mobility. First, ज़्यादा गीला तो नहीं है, कहीं patient गिर गया. Bed post में railing लगी है कि नहीं है. Supervision to prevent wandering in patients with dementia or confusion. Ensuring the use of assistive device like walker or handrail if needed. Then activities of daily living. Assisting with daily tasks such as bathing, dressing. You can assist the patient and later on you can motivate the patient to carry out on of their own. All right. Because most of the time you will see patient either because of some disability won't be able to get up or bed sore हो रहे हैं या क्या हो रहा है. This is something which you have to keep in mind. So proper, bed turning of the patient is also important. You have to give very simple and clear instruction if you are seeing a patient with organic brain disorder is there. Don't give instruction which will confuse the patient. Okay, take medication. एक simple instruction है, दवाई दिया, खा लो, पानी दिया, पी लो. All right. So you have to be very clear in what you are telling the patient to do. using clear and direct communication and employ visual aids whenever necessary. When patient is unable to understand you verbally, आप दिखा के फोटो दिखा के भी सिखा सकते हो कि ये करना है, यहाँ उठ के जाना है. Avoid complex instruction and offering reassurance. Nutritional support, again monitoring food and fluid intake. Many a time अगर आपको लग रहा है patient solid food नहीं खा रहा है, you can ask doctor to change the diet to solid, semi solid or liquid food. यूरिन आउटपुट तो कम नहीं है, फ्लूइड इनटेक तो कम नहीं है, अगर आईवी फ्लूइड्स की जरूरत तो नहीं लग रही है, तो दिस इज समथिंग व्हिच यू कैन मॉनिटर एंड कैन एड्रेस द सेम टू द fellow doctor. Management and sleep disturbance, increasing a consistent sleep schedule and create a quiet and calm environment to improve sleeping pattern. Address sleep disorder common in OPD patients such as insomnia or day-night reversal. Again, palliative and end-of-life care to provide comfort and symptom relief. All right, do you understand the role of nursing currently? You all will be able to write. Okay. Then we have follow-up, home care and rehabilitation. Why is follow-up required? Because you have to see whether the symptoms are monitored properly, whether the disease is improving or the cognitive decline. Very good. Relapse to nahi ho raha hai. So continuous monitoring for disease progression and treatment effectiveness. Follow-up should be scheduled regularly to adjust treatment plans and assess cognitive function, mental status and physical health. Key component, you should cognitive behavior monitoring. These are some tools which we can use. Agar nahi bhi aata to no problem. Reviewing of the medication, assessing the effectiveness and side effects of prescribed medication, managing the symptom like aggression or depression. Again, hydration and nutritional status. Home care mein again you have, once the patient is going to home, environment of the home should be safe. Caregiver should be must thoroughly educated and given a proper social and moral support. Daily routine establishment is very important thing. He encourage consistency in patient's routine to reduce confusion and anxiety. Cognitive stimulatory exercises कि कुछ ना कुछ patient करता रहे, कुछ puzzle खेल ले, सुडोको खेल ले, garden में जाके थोड़ा सा बैठ जाए थोड़ी देर. Again, nutrition and hygiene. Again, rehabilitation. What do you understand by the term rehabilitation? Tell. Regain karna. You are going to habitate the patient again. Okay, rehabilitation. Is it? To restore or maintain maximum functional ability, improve quality of life through physical, cognitive and psychosocial rehab. Physical rehabilitation आप physiotherapy कराओगे so as to कि जो muscle power है वो atrophy ना हो जाए. Focus on improving mobility, balance, coordination and prevent muscle atrophy. Cognitive rehabilitation, you have memory training or problem solving activity. Restore focus on restoring abilities that are needed for daily activities. Then speech and occupation therapy. You can, if the patient has difficulty, after aphasia or something, have difficulty following proper instruction to speak, you can suggest a speech therapist. Occupational therapy to help patient regain independence in performing activities of daily life. Psychosocial rehab to manage agitation, depression, group therapies and social interaction to reduce isolation. Then community-based we have halfway home or daycare system where patient can go spend some time amount of time. Some of the daycare system also have some kind of vocational training or job supply to these patients. So these are also the things which can help in adapting the patient normally to the community again. Then technological advancement. There are certain trackers, alarms, customized communication devices which can help to assist patient in their daily functioning. Clear? So what did you understand from today's lecture? One of you tell in brief. Who will tell? Whatever you understood. पूरा नहीं बताना है. Sometime you will tell something, other people will tell. Anyone? नहीं समझ में आया मतलब? आया है तो बताओ फिर क्या समझ में आया. Very good. So take home message, You should learn how to differentiate between organic brain disorder and psychiatric illness. You should know what are the investigation and management and rehabilitation, everything. All right. Chalo. Thank you. These are the references. Any questions? Done? Chalo.